The PenRad Mammography Information System, MIS, class category leader for MIS 3 consecutive years. PenRad MIS is ranked number 1 in the industry for MIS technology by its users and class, a leading research organization specializing in the performance of healthcare vendors. Class named PenRad MIS the leading mammography information system for the 3rd consecutive year in 2010. Rankings by class are based on product quality, ease of use, and price, as well as customer support. As a comprehensive mammography information system, PenRad MIS delivers the most cutting-edge technology for reporting and tracking of clinical data. PenRad MIS offers improved mammography reporting and tracking workflow while offering faster turnaround time for exams, automation of tasks, and elimination of duplication, secondary data input, and transcription, and increased productivity and economics. Here's a quick demonstration of PenRad MIS. As an efficient client-server-based program, PenRad MIS improves access to mammography within your facility. Technologists and radiologists have access to PenRad anywhere they need it. Technologists log into PenRad by simply choosing Log On as Technologist, select their name from the list of technologists at the facility, and then enter a unique passcode. This passcode can be changed by users individually on whatever basis is preferred by the facility. 30, 60, or 90 days is common. This feature is required for HIPAA compliance and is a good security practice. To begin, we'll select our patient off of a work list. Simply locate the desired patient and click on Preliminary Exam. We're going to create a pre-exam record for the radiologist. PenRad makes it easy to go paperless. You'll see the more information we can put into PenRad, the more information the radiologist will have available to them when they access the exam. Items highlighted in blue on this screen will be part of the exam. In this case, we have a bilateral digital screening mammogram with CAD and the date the exam is being performed. We can also add different modifiers to the exam. MQSA requires us to capture whether the patient is pregnant or has implants, so we'll answer these questions first. Then we're just going to go through a series of items to create the pre-exam for the patient. Does the patient have any indicated problems for the current exam? Did she come in today with any pain or lump? Is there anything else that she's indicated to the technologist? If so, we just click on that item and place it on the breast image. When the radiologist opens up their screen, they're going to see these images and will see that this patient has reported a lump, the date, and the location. We can add multiple indicators here or none. Next, we're going to add risk history information regarding the patient. This is a one-time area. We can use the slider bar on the right and add when the patient's first menstruation and first full-term pregnancy occurred, the number of children breastfed, etc. The technologist can fill out as much information as they choose. Once we enter this information, it will be here when the patient returns for subsequent exams. The breast history area is a list of all exams that have been done for the patient. When the radiologist opens the patient in PenRad, they'll have a running list of all breast-related exams that have been done for this patient. We can always come back here and add new items if necessary. The technologist then attaches their name onto the exam itself along with the date and time of the imaging. The other information on this screen is used for QA/QC of your imaging units. Most digital imaging facilities have QA along with their imaging modality. Analog sites can use this screen to enter reject types and counts for their records. Additionally, they can run statistical reports from those entries. Once the information is entered, the technologist can input the reason for today's exam. PenRad refers to this as clinical text. Within clinical text, you can create a series of phrases. The user can click on a custom phrase, and PenRad will automatically populate the text into the clinical text area. This information then becomes part of the report as the reason for today's visit. Again, we can create a list of these phrases. As you can see on the left side of this screen, there is a whole list of different statements that can be added to the report. If your facility requires it, the technologist can also add comparison films to the study, or the radiologist can enter them prior to interpreting the study. You simply access the comparison screen and select the films that we're going to use for comparison. They will then automatically display on the left side of the screen. Those are the films that are going to be used for comparison. The right side column displays all of the exams that are available for comparison. Once the technologist is done imaging the patient, they simply click Done, Go to Schedule, and this exam is placed on the scheduled patient list where it would be available for the radiologist to read. Clicking this button brings us to the scheduled patient's work list where we see this patient in an imaged status. This indicates to the radiologist that the exam is ready to be dictated. Now we'll log in as a radiologist and dictate a report or two. As you can see, PenRad is very easy to use. The radiologist simply selects their name from the radiologist list and puts in their unique passcode, similar to the technologist login. The radiologists are going to be working off of the exams list. This is a list of all of the exams that have been acquired, read, or suspended for any reason. PenRad uses this status column to indicate whether or not a patient needs to be read, is waiting for outside films, etc. In this case, we have a pathology that's required. Complete indicates the exams have been interpreted and are waiting for their patient letters to be printed and the final report committed to the PenRad database. These lists can get large, but clicking the Show Only Imaged button will take all of the patients that have been completed off this work list. PenRad also features other filters to make this list even smaller. Maybe the radiologist wants to see only mammograms, or just procedures, ultrasounds, etc. There are a number of ways PenRad can filter the work list to accommodate each radiologist's workflow. The radiologist can also click on any one of these column headers to sort exams by date, location, etc. We'll double-click on an exam and PenRad will automatically populate exam info. There are a number of different settings that can be turned on or off in PenRad. One of the settings currently active for this demonstration is the Auto Negative feature, which makes interpreting exams very efficient. This feature allows the radiologist to skip the pre-exam portion in PenRad and go directly to the negative screen. This is helpful when interpreting screening studies. Items that are highlighted in blue will be part of your report. The tissue density in this case has defaulted to heterogeneously dense. Density defaults are based on patient age if the patient has no prior PenRad exams. In our example, the patient likely had a prior exam in PenRad and heterogeneously dense was selected for that exam, so PenRad inserts the density from that previous exam. The radiologist can always edit it if the density has changed. We'll say there were no significant changes. Select a recall interval of 1 year and choose a normal exam letter for this patient. You also have the option to add additional benign breast composition on this screen. While it's still technically a negative report, we can add calcifications or other benign composition as needed. There are 4 columns, 2 for the right breast and 2 for the left. One column is singular and the other plural. So we can say there are scattered densities or scattered calcifications in both breasts. This does change our BIRADs to benign, as we did note some small findings. Then we'll just click Approve. We then get a preview of the report. This is a simple, standardized report. Now let's say we have a diagnostic exam, or an exam where we actually have a finding. We'll just select our patient from the exams list and the screen populates. We've indicated that this patient has pain in the left breast. The radiologist will want to review this area. We have our comparison films that have been selected for this exam, the patient's medical history on the bottom left, and at the bottom center, all of this patient's prior procedures are listed. We can see all of the exams that have been done for this patient, her risk factors, etc. PenRad will highlight the risk factors, weak, intermediate, or high risk, and color them accordingly. In this case, weak is yellow. Intermediate would be green, and high risk would be bright red, so it's more of an eye attractor for the radiologist. We also have all of the prior exams available for the radiologist to review right in front of them. By simply clicking on one of the exams, the radiologist can view a copy of the previous report. There's no need to filter through any old paper reports or go elsewhere to look for an exam. Everything is stored in PenRad and is easily accessible. Now the radiologist clicks on Detailed Mammo and PenRad will display the breast images. In this case, the technologist indicated that the patient had pain in the left breast and the radiologist is going to indicate a finding. We'll just click on Add Abnormality, place it on both breast images, and if I move the indicator, the abnormality moves in both breast views. On the right side of the screen, we'll see the clock location of the abnormality and the depth. We'll just place it where we want it. We can give it a one-dimensional size here, or we can give it a three-dimensional size when we detail our finding. Once the abnormality is in the correct spot, we'll click on Detail Left, and now the detail screen displays with some items in the left column. Once the abnormality is clicked, the rest of the screen will populate. The radiologist indicates to PenRad what he or she sees, and additional options appear. The radiologist simply selects the correct verbiage to describe the abnormality. In this case, we'll say we see a mass. Now all of these other descriptors fill in. Again, we just need to tell PenRad what we see and our impression of the finding. Everything else is for reporting purposes. Maybe the abnormality is lobulated in shape. Maybe it has an obscured margin, and the changes may be new. Are there associated calcifications? Do we see any other findings that go along with it? We can add those if we choose. Then we can give this exam an impression. Here we'll say we need additional imaging for this patient and maybe an ultrasound. When the radiologist is dictating their reports in PenRad, every screen has an Add Text area where free text can be added to the report. The ability to add free text means that the radiologist can always describe exactly what they want to say in their own words. And again, we can create a list of custom phrases that we use regularly. If there are certain items you continually use when dictating, perhaps you like to say a certain phrase when you see calcifications, it can be added to the phrase list. Then you can just click on it, and PenRad will automatically put that phrase in the report. Once detailing is done, click OK. In this case, the BI-RADS value is 0. We'll click on Approve Preview, and this is where we tell PenRad when we want to see the patient back, let's say an immediate follow-up. We need to indicate why we want to see the patient back, in this case for an ultrasound, and what letter do we want to give the patient, additional imaging needed. Then we'll click Approve, and a copy of the report is previewed. Again, PenRad reports are structured the same way for everybody. This report is showing that we have used CAD, we have a 1.6 centimeter lobulated mass, and we want to do additional imaging on this patient. We can also add certain phrases like the one here regarding the patient's calculated risk of breast cancer, 1.3 and lifetime of 9.3%. In this case, PenRad is set to automatically populate this information. This can also be turned off. We can also have different phrases automatically put into the report for you. If the radiologist likes what they see, they just click on Agree, and this report is done. PenRad also alerts the radiologist about any unresolved cases that they may have started. Here, this patient had an unresolved study that they came back for. If this case is resolved, the radiologist just clicks on the Resolve button. PenRad shows the radiologist a copy of the report to make sure they agree. If they agree, the radiologist clicks Close, and now we've resolved any unresolved cases that we had for this patient. This keeps the unresolved list nice and clean. Again, this is an option in PenRad. The status for this patient is now complete, which means that the exam has been read and our interpretation is finished. This exam is ready for the batch print process, and a patient letter based on the standardized letter that the radiologist selected is ready to be printed. PenRad can automatically fax a copy of the report to the referring doctor or send the report to the facility's RIS system. PenRad optimizes the way facilities report and track clinical data. All of our clicks have been captured. Administrative reports or statistical reports for our medical audits are available at the click of a button. If we go to the Administrative Reports area, we'll find a list of many reports available in PenRad. One report, for example, is a medical audit report. We just set our date range, and you can preview the results. Here, PenRad has broken down the data by radiologist. We can break this down individually or by facility, whatever is preferred. We see the number of mammo cases. Of those cases, how many were BI-RADS 0, 4, or 5? Of those, how many became a BI-RADS 4 or 5? The number of cancers that came out of that. True positives, false positives, positive predictive values, and recall rates. This information is displayed as well. There are a variety of reports regarding pathology statistics, quality control, etc. We can find out the number of BI-RADS 4s and 5s read, a count of exams performed by radiologists, all BI-RADS 0 studies, etc. Maybe I'd like to see all of my BI-RADS 0s for the past month. I just select the dates, and now I can see all of my BI-RADS 0 cases. There are none in this case, but we would have a list of all of the cases that were available that were read. Now we have a list for our nurse navigator who can go ahead and follow up with those patients. PenRad MIS, optimizing productivity and revenue in mammography workflow. To schedule a demo, email sales@penrad.com.